a lot of the stuff that we've done so far is stuff that I think about every day. About the processes with the bloodlines and how the genetics are passed forward. Some of the stuff we're getting into is historical stuff that I every now and then think about. So it may not flow quite as readily. We'll see.
Yeah. Yep, we got a lot of great feedback from the first couple of episodes. We got a lot of useless feedback as well. We appreciate everybody that watched and shared around. We thought we'd get a couple thousand views, but I think we just hit 20,000.
Did we?
So we appreciate everybody that watched and looked through and shared with everybody.
Yeah. Maybe I'll say that in the beginning.
Yeah. So there was some really useful stuff in terms of questions, like questions that we can ask on here and that are helpful. I think I really appreciate the comment I got about my Mr. Rogers demeanor. I don't know if they were meaning that as a dig on me or not, but I'm a huge Mr. Rogers fan, so thanks for that.
I think most of us are.
Yeah.
I think the kind of person who would dislike Mr. Rogers probably wouldn't be in our friend circle.
Yeah, for sure. All right, and there were a lot of great questions, not helpful stuff, just to get some of the negative stuff out of the way before we get into the interview. Not helpful stuff is these questions aren't good, or these questions are not hard-hitting enough, and then not giving me a hard-hitting question or a good question. So, like, if you want to criticize it, I'm welcome. Like, some of the audio and video criticisms, they were great, so we changed a few things, and hopefully we get a little bit better audio and video this time. But if you don't like something, just give us a question that you'd want to hear, like we'd ask for, and we'll be happy to get it in there if it's a great question. And also, moving forward, we're going to be asking a lot of questions that we really care about, and our initial video was just for fun, just absolute nonsense questions that we see on Facebook to just have some fun and address. So
yeah, with respect to both points that you've just made, now would be a good time to reiterate that the purpose in doing this is not so much self-promotion for me.
yeah,
It's not me on trial or me showing out. It's me trying to pass forward knowledge about our breed, so to the ultimate end of better treatment, better understanding of the pit bull around the world. I hate to say this, but there's more harm done to the pit bull breed by people who are ignorant than probably by people who just are biased. People just don't understand the essential nature of the breed, and a lot of times they're following bizarre value systems that may reflect more of some culture than it does of a true understanding between man and dog. So most of what I'm trying to do here is pass forward information that I have collected over my 45 years. Not so much just collected, but some of it is collected, and a lot of it is a lot of it will turn out to be unique within your experience because a lot of it I've created. But I'm happy to share my time and my energies to the betterment of the breed, the higher quality living for our dogs, better understanding of the breed, actual improvement of the breed so that the breed is admired on the level that it deserves and is respected from the perspective of society. That's my reason for doing this.
All right. Well, hopefully now that we're getting into things that I think can help people, we'll get just as good of a response. Because as much as people said that the questions were goofy coming from Facebook, it got 20,000 views. So hopefully now that we're into more helpful questions, we'll prove it that people don't just want to hear nonsense. Maybe 25,000, 30,000 people want to hear things that can help people. So just to start this out with some for sure helpful stuff, one of the most important things, I thought the best compliment that was given in the comments for you to speak on was on animal husbandry. So the care of the animals, how to do better than good. So if you could just speak on animal husbandry and just taking care of animals in terms of like vaccinations, some of the medications that we use, timetables for medications and things like that, that may be helpful for some people.
That can be a fairly elaborate thing to get into, but if now's the time, then we obviously work very hard to to have an efficient operation. It all comes down to how much work you want to do and how much good you want that work to do. And if you understand the science of it, a lot of this is about honoring the correct vaccination schedules, keeping parasites out of your animals, providing proper nutrition. And I see so many people out breeding dogs and managing yards of dogs that they've got parasite problems, and they just keep upgrading and spending more and more money on dog food. Whenever what they're really trying to do is they're trying to compensate for they're trying to feed the parasites and the dog at the same time. We feed a high quality dog food that's been found to be acceptable throughout the fraternity across the nation. We feed Value Pack Black Bag. That's a 28-20 dog food, 28% protein, 20% fat, and by virtue of buying it in tractor trailer load lots, I think the last I bought was like $33 a bag. For you guys out there that are paying $50 a bag, I'm sorry to even share that with you because I know that hurts you in the gut. But the point is that if you stay on top of things and find value wherever you can find value without shortcutting what your dog is eating, the opportunities are out there. I just mentioned the necessity of keeping parasites out of your dogs. There's a variety of worms, there are several types of tapeworms, but there are some things out there that are not commonly known. Whenever you're raising a litter of puppies and you suddenly everybody's got a bloody stool, if you've been in the dogs long at all, you know that doesn't lead anywhere good. Usually it's going to turn out to be either, if they got bloody stools, it's going to turn out to be either hookworms or giardia or coccidia, or there are bacteria that will cause a bloody stool, and most people don't know much about the bacteria that will give the same symptoms. A common scenario is to see a bloody stool either in a litter or in an individual. Take the dog to the vet. The vet will identify, will look at the stool and say, we've got giardia here. What they don't explain to you is that almost every dog in the world has giardia. The question is does it exist at a clinical level? In other words, is there enough of it to cause this bloody stool? If there is, then it's going to impair the health of the dog. A dog can't constantly lose blood and be at peak health. But the fact that they found giardia and that the dog has a bloody stool is no guarantee that the giardia is what's causing the bloody stool.
Sure.
Given the fact,
when you say a clinical level,
yeah,
can you explain what you mean by at a clinical level?
That basically the symptoms are observable to to any knowledgeable viewer, or to even not knowledgeable, anybody can see blood in a stool. It means that it has manifestations that are evident to anybody assessing the health of the pup.
Yeah.
So, a subclinical level, the dog would have detectable Giardia. In other words, you look at the stool sample under a scope under the right conditions, and you'll be able to see Giardia, but there won't be any bloody stool.
Sure.
So you have to know to distinguish between correlation and causality.
Right.
The presence of the Giardia does not mean it's the cause of the bloody stool.
Right. Basically, the presence of it doesn't mean that's what you need to treat. It could be something else.
It doesn't mean it.
Yeah.
And to make it even more complex, you've got different strains of Giardia that will respond to one medication or another. So here's a typical course of action. You take your pup in. The vet examines the stool, determines that there is Giardia present in the pup, gives you either metronidazole or fenbendazole. You go home, you treat this pup, and after about 3 days, you feel like you're seeing a positive change. Either the bloodiness is gone or it's diminished. But then 4 or 5 days later, it's back. And you've done a full course of treatment. So you go back and the vet will, whichever medication he prescribed, if it was fenbendazole, now he's going to prescribe metronidazole.
Sure.
Or if he's prescribed metronidazole, now he's going to prescribe fenbendazole.
Right.
So you go home, do the treatment, you have exactly the same course of events. You get a reduction in the bloody stool, and then you get a return of the bloody stool. So you go back to the vet, and the vet says, well, let's use them together now. Okay, so by now you're cussing a little bit because you spent hundreds of dollars and you still got this issue, and it leaves you exasperated. And I know there's probably 1,000 people out there, whenever they see this interview, that's going to say, yeah, because they've been in that frustration. It's baffling. But anyway, you go back, you do the treatment with the two together, and you later you look at your bill, and you see where they've
an antibiotic.
Yeah,
In the bill.
they've added clavamox.
Yeah.
Okay, clavamox or even just amoxicillin knocks out a bacterium called Clostridium perfringens, and as often as not, that was the actual true cause of the bloody stool, as opposed to the Giardia. Not saying that Giardia ain't real. It is, and it's a nasty thing to deal with. One reason that it's so nasty is that the Giardia occur in little pods that close up and seal themselves off, and it's very hard to kill them under that condition. Whenever they've gone dormant and wrapped themselves up in this little pod, it's very hard to kill. But at any rate, what this all adds up to is, after having gone through this routine numerous times, and doing a little more reading than most people do, learned a little more about the Clostridium perfringens, and that it's relatively easy to knock out either with just amoxicillin or clavamox, which is supercharged amoxicillin with potassium added. And we don't want to have a 4-week routine clearing up a bloody stool. So what I do is I purchase metronidazole and fenbendazole and amoxicillin in kilo-sized lots, and very carefully select the correct doses, very carefully evaluated the compatibility of all these medications. There's no contraindication of any combination or collectively of those medications. So I'm able to add those medications to a carrier agent uh, what's healthier than flaxseed oil? That's what I use as a carrier substance, and mix the other three antibiotics with the flaxseed oil in the proper proportion. Blend it and keep it on hand anytime we have a bloody stool in a pup here or in a litter. In just a few days, it's gone and it stays gone. So there's lots of things like that if you know them and you know how to be on top of them, you can totally alter the trajectory of your operation. You can maintain a high degree of health in your operation as a whole. Another thing I should mention is how difficult it is to keep hookworms out of your dogs. Over the last 10 to 15 years, medications that were very effective at clearing hookworms lost their effectiveness. One can just assume that hookworms evolved, and it didn't become widespread that was the case. But I had enough vets assure me that the evolution had occurred. There's only one medication that continues to be highly effective, highly reliable in eliminating hookworms, and that is ivermectin. You should already be giving every pup or dog in your care a treatment of ivermectin every month to prevent heartworms.
I thought ivermectin was only for horseworm medication and to save Joe Rogan from COVID-19. You can actually use it on dogs.
Well, it won its Nobel Prize for a special fever in Africa, and it won that Nobel Prize because of its efficacy in achieving its objective, but also the safety that accompanied that. It didn't have a handful of side effects. As I understand it, the way that it works is that it disrupts the communication from one end of a cell to another, and that doesn't necessarily mean just a cell. Even in viral particles, the ability of one end of the viral particle to communicate with the other end is disrupted by the ivermectin, and so that's the reason that it has found utility in treating bacterial diseases and also viral diseases. But we all love Joe Rogan, and we're glad that whatever good he got out of it, that he did. And I know a ton of people that are absolutely confident that their ride through COVID was made much more manageable by the presence of ivermectin.
Yeah, myself included.
Yep.
And I read a study that showed that it slowed down viral replication.
Yep.
Like, I didn't just take it because people said it worked.
Yeah.
Now that study may have other studies that say otherwise, but it was enough for me. So.
We share the love of Google, and probably we share the hate of Google, because there's a lot of truth to be gleaned from Google. Google's probably educated more people than any university in the world, but at the same time, since a lot of that information comes from people, there's as much bullshit mixed with it as there is truth, and you still got to be able to sort it out. But at any rate, you add a dose of politics to it, and then there's intentional obscuring of the truth, and but still there's enough truth to be gleaned just from going and reading studies. And I've done a lot of reading throughout my life, but in the last 30 years, most of it's just been reading studies, because most everything else is just meant to entertain.
Sure. Just a lot of people's ideas.
Yeah.
I didn't mean to get you off track. We were
It's
talking
fine.
about puppies got bloody stools. We were talking about things that happen to dogmen all the time. Puppies got bloody stools.
Mm-hmm.
We've gone to the vet. He's tried to treat 3 things. So now we're at metronidazole, fenbendazole, and an antibiotic.
Yeah. So, elaborating on that, we've moved over to ivermectin as being an effective treatment for way of managing multiple things. Heartworms kills the microfilaria in the bloodstream if you have developing heartworms. But probably the biggest benefit that it has is if you're actually treating your dog with ivermectin as a heartworm preventative, and that's what HeartGuard is. It's ivermectin. You are at the same time eliminating hookworms from your dogs. The way we manage that here on Bulldog Hill is as many dogs as we have here, you have to look at all aspects of what's involved in the application of any given medication. So we use a transdermal form of ivermectin, which is actually made for cattle. By transdermal, what that means is you have chemical agents, typically solvents, which will combine with substances. It's been my experience that in most cases that if what's known as a transdermal solvent, to which DMSO is the one that I primarily work with, if it is a solvent for a substance in particular, and if that substance in particular has a molecular weight under 700, that it will drag it right through the skin. It will become systemic without going through the digestive system, without going through the liver, which is where first pass occurs. A lot of things can't pass through the liver without being diminished or eliminated. So the way that you can get certain medications through the skin without going through first pass, without being filtered out by the liver, is to use a transdermal solvent. And again, the criteria would include that the substance needs to be soluble with your transdermal solvent, and it has to have a molecular weight under 700. It's probably a little more esoteric and involved than most people want to get into, but there's 2 or 3% out there that are saying, hell yeah.
And about 97% that might be saying, what's transdermal? Which just means it goes
across
through the skin.
Yeah,
right.
Exactly. Yeah. So getting back to what we do here, we use a product that's made for cattle. Dervet is the brand that we use, and we give every dog in our possession, every dog that's above 4 months old, that's in our possession, they get dosed 1 milliliter per 22 pounds of the Dervet product, and it's a transdermal solvent mixed with ivermectin. It's dropped between the shoulder blades, goes right through the skin, gets in the system. And we don't have hookworms, we don't have heartworms. So you have to pick out a day of the month and reliably provide that agent.
And toxicity of ivermectin?
Again, it was selected for the Nobel Prize largely on its safety.
Yeah.
Most everybody I know is taking it in relatively large doses for weeks at a time whenever we went through all the COVID mess, and I've not seen any negative consequence on anybody.
Yeah, I haven't. Sometimes if I'm worried about the weight of a dog, if it's a 50-pound dog, like I'll just dose it at 3 milliliters. So at what it would say 66 pounds is, but no problems.
Well, that reminds me of a study that I read when I first started using ivermectin, which was in the late 1980s. And that study was done at Tulane University. Sample size was not huge, probably 30-ish, and they overdosed by a factor of 10. And of all the dogs that received 10 times of the dose that they were supposed to receive, there was one dog that got a little bit sleepy.
Sure.
Who knows why he got sleepy? He maybe didn't sleep the night before, but that's the only thing. Lethargy is the word they use for that, and but there was no lasting consequences, and it's super safe.
Not to overdose your dogs, but there's a wider range that you could be safe with that medication than with most other medications. And
there are different recommended dosages for different applications. So whereas what I've settled on after all these years is for heartworm preventative And for hookworms, like a 50-pound dog, we get about half a milliliter. The original dosing just for heartworm preventative was 1/10 of a milliliter per 40 pounds. And that was what originally came out of the Tulane study. But the safety factor is so great, and you increase the number of pathogens or parasites that you can eliminate significantly whenever you elevate the dose. So a good compromised dose, about a half a milliliter per 50 pounds.
So just to kind of wrap up, we'll probably go into husbandry a lot more because you can talk about housing.
I can keep talking on this if you want me to, but there are some people getting right now, I promise you, that are getting cross-eyed from the technical aspects of some of this, and they want to be entertained a little bit. So
yeah, just to wrap it up, for the three main medications that we've talked about, ivermectin, fenbendazole, and praziquantel. That's our main medications that we use monthly. So if you could just kind of give people a summary of time frames to use that and how it's used.
Well, I buy, again, my fenbendazole in kilo-sized lots, and mix it with RF1, which is a nutritional supplement that I also manufacture. It's the number one leading conditioning aid nutritional supplement package in the world for this breed. And but since I make my own, I'm the one who formulated it and I'm the one who manufactures it. And dogs find it so tasty. It is an ideal way of simultaneously addressing any minor nutritional deficiencies that might exist in the dog, and if you mix it with worming medications, you're doing two things at once. You're killing the worms and trying to feed them back up to spec again. So we will do these applications of fenbendazole in pairs. And the reason for that is fenbendazole is an effective wormer against most all worms that we have to worry about, except for two. One is the Echinococcus tapeworm, and we use praziquantel for that, and the other one is the hookworms, and we just talked at length about that. So for everything else besides those two varieties of worms, we're providing fenbendazole. And I don't try to remember all these things, but sometimes the numbers stick with you. We end up giving about 1.5 grams per 60 pounds. And these dosages are commonly available, very, very well established. But we'll mix a kilo of fenbendazole with about 17 pounds of RF1, mix it up very thoroughly. You absolutely have to end up with a homogeneous distribution. So it's got to be thoroughly mixed, and so that's given. And since fenbendazole is only truly effective against the adult state of these worms that we indicated are susceptible to it, you still have the juveniles lurking, and so you give it to everybody for 3 days. And that covers all these worms. If you want to make a good effort towards eliminating Giardia, although there are other experiences that tell us that it's not always effective by itself. But if you want to make a good effort at it, you can go 5 days. So 5 days of fenbendazole will cover all these worms we mentioned, and a good stab at Giardia. But you have to repeat in 3 weeks to allow the time for the juvenile state of the worms to reach adulthood, and then the fenbendazole will knock them out as well. So that's how we talked about how we use the ivermectin for the hookworms. We've used the fenbendazole for the bulk of the worms. That leaves the one worm that the fenbendazole won't get, and that is the Echinococcus tapeworm. And we use praziquantel for that. I mix it up with the RF1 in its own separate container. And the first 2 days of the 3, we will give praziquantel. Some studies indicate 1 time would be enough. Some studies indicate that maybe 2 times is necessary. So we don't want to leave question marks. So we do 2 consecutive days of the praziquantel mixed with RF1 at the same time that we're giving the fenbendazole mixed with the RF1. The one detail that we haven't covered yet is how frequently do we need to do these 2 pairings. So we'll administer the fenbendazole, skip 3 weeks, administer the fenbendazole again, and then we will rinse and repeat 3 months later. So you end up doing this about 4 times a year. That works very well for us. Our dogs are typically quite healthy, and it's unusual to have any kind of parasites in our dogs after following these routines.
And then monthly ivermectin.
Yeah, the ivermectin is once a month. The thing that we haven't really covered yet is vaccinations. There is a superb vaccination for parvo. Parvo is the biggest thing you have to worry about in terms of infectious diseases. And there's a company, Neopar, over in Tennessee, and we have a very good relationship with their researchers, and we're able to stay. They keep us apprised of any developments and any changes in recommendations, and so we have a protocol that we follow that starts these guys off at 6 weeks with Neopar. What most people don't realize is there's not a set number of vaccinations that you give. I have people, whenever I sell them a pup, they'll say, well, how many sets of shots have you given? They had their 3rd set yet? Well, to start with, shots don't come in sets. It's an individual thing, and there's no way that it should be even talked about like that. At any rate, there's not a finite number. If you start at 6 weeks, you got some vets that will recommend 3, even 4 weeks, which is ridiculous. We give every 18 days, and the more frequently you give them, up to a point, the less number of days that your pup is gonna have, in which they are basically naked in the wilderness, no immune function going on. The immunity is a certain amount of immunity is passed from the mother, and your objective whenever you're vaccinating a pup is you want to eliminate the maternal immunity and replace it with acquired immunity. And the only shot that counts throughout this whole process, even though you're starting at 6 weeks, administering a shot every 18 days until they're 5 months of age, the only shot that counts is the one immediately after the maternal immunity has been eliminated. So that's one reason that we use the Neopar vaccine, is because it's very powerful, it's very strong, and the stronger the shot is, the more effectively it knocks out the maternal immunity and replaces it with acquired immunity. So, but it only comes in a parvo-specific vaccine. It's only going to treat parvo, or it's only going to prevent parvo. So that leaves you needing to have a vaccination that addresses parainfluenza and distemper, etc. So we alternate. We will give the Neopar, and then the next week we'll come back with a quality 5-way, which helps to build immunity against distemper and parainfluenza and hepatitis. So we go back and forth until we get 3 or 4 Neopars in the pup, and we will do the shots in between the Neopar shots. We use the 5-way to make sure that we're covering all the pertinent diseases, and again every 18 days until they're 5 months of age.